name's Dakota. I'm going to be your student nurse today. Can I have your full name and date of birth?
Kristen Cassidy, and it's 12/18/99.
Okay, and then can I see your wristband? Okay, thank you. And then do you have any allergies?
No.
Okay, so I'm going to go ahead and perform a cardiovascular assessment today. So I'm just going to take a look at your chest and at your neck, and then I'm going to go ahead and listen to your heart sounds with my stethoscope. Do I have your permission to go along with this assessment?
Yes.
Okay, so go ahead and let me know if you have any pain or discomfort at all throughout the assessment, okay? So I'm going to go ahead and start with the general assessment. So patient is an age-appropriate, well-groomed female. No signs of cyanosis or pallor. Can I see your legs really quick? No signs of edema, no apparent signs of edema. Patient does not appear to have labored breathing or have any signs of pain or discomfort. Okay, I'm going to go ahead and start by asking you a couple questions. Are you currently on any medications right now?
No.
Anything prescribed or over the counter?
No.
Do you have any chronic illnesses, like any problems with your kidneys, any diabetes?
No.
Okay. How is your exercise? Do you exercise often?
Yeah.
Okay, then would you say it's kind of more running, walking, weightlifting?
Mostly weightlifting.
Okay. Do you smoke at all?
No.
Any vaping, marijuana, cigarettes?
No.
Have you ever had any heart tests done, any EKGs, stress ECGs?
No.
Start by taking a look at your chest. Chest is symmetrical, no signs of deformities. Chest has typical roundness. No signs of any excessive concerning retractions. No signs of surgical wounds, surgical incisions, or any surgical implants. Go ahead and just inspect your neck. There are no signs of any pulsations or distension on the carotid jugulars. Okay, I'm going to go ahead and lightly palpate, lightly touch. Okay, pulses are a nice strong 2+. Regular rate and rhythm, equal and clear bilaterally. So now I'm going to go ahead and take a listen with the bell of my stethoscope. Okay, so go ahead and hold your breath for me really quick. Okay, and go ahead and breathe. I didn't hear any abnormal sounds, no bruits, so no signs of no sounds of whooshing. I'm going to go ahead and palpate your apical pulse. So can you go ahead and roll up your sports bra and lift your breast, please? I should be feeling this in the 5th intercostal space. Apical pulse is palpable, nice and strong, no heaves or lifts. I'm going to go ahead and auscultate and take a listen to your heart sounds. I'm going to be starting in the aortic valve, going to the pulmonic, herbs, tricuspid, and the mitral valve. So I'm going to go ahead and start by listening with the diaphragm on my stethoscope. And I should be hearing louder S2 sounds in the aortic and pulmonic valves, and then I should be hearing stronger, louder S1 sounds in the herbs point, tricuspid valve, and mitral valve. So I'm going to go ahead and take a listen. Regular rate and rhythm, no abnormal extra sounds, no murmurs in the aortic. Now going to the pulmonic. Again, regular rate rhythm, no murmurs, no extra heart sounds. Herbs point. Regular rate rhythm, no extra heart sounds, no murmurs. And then tricuspid. Regular rate rhythm, no extra heart sounds, no murmurs. So go ahead and lift up for me again, please. Okay. Mitral valve, again, regular rate rhythm, no extra heart sounds, no murmurs. So now I'm going to go ahead and do the same listening technique using the bell of my stethoscope. Okay, aortic and pulmonic valves, regular rate and rhythm, no abnormal sounds or murmurs. Herbs point. Regular rate rhythm, no abnormal sounds, murmurs. Tricuspid. Regular rate rhythm, again, no abnormal sounds, murmurs, and then go ahead and lift up. Okay, mitral valve, no abnormal sounds, no murmurs, regular rate and rhythm. Okay, your S1 sounds are the closing of your atrioventricular valves, which are your tricuspid and mitral valves at the beginning of systole, and then the S2 sounds are diastole, so at the beginning of diastole, the semilunar valves, the aortic and pulmonic valves are closing. And it's important to identify any abnormal sound locations because you want to identify which valve might be malfunctioning. Okay, that's going to go ahead and complete our assessment today. Do you have any questions?
No.
Okay, thank you so much. Foam out.